Good days to all. We are Group 5 and we are going to present to you about the ventilator. First, ventilator is a device that helps patients to breathe when they are unable to do so on their own. The technology related to ventilator has advanced significantly during the last few decades. Nowadays, ventilator plays a very important role in treatment of almost all severe disease, as most of the patients in that conditions will have a difficulty in breathing. Ventilators are majorly classified into two types, which are the manual resuscitator bag, or in another word, face mask ventilator, and the other one is the mechanical ventilator, which are commonly used in the hospital. Next, I would like to pass on to Fujin to present the manual resuscitator bag ventilator. Thank you.
Air blows into the airways and lungs. It is used as a first aid material before sending the patient to the hospital. I will now pass the time to Carlo, where he will talk more about the positive pressure ventilators.
Thank you, Fujin. I'm Carlo and I will be explaining about the positive pressure ventilator. Positive pressure ventilator is commonly used in many treatments. The principle of positive pressure ventilator is delivering of the air or a combination of other gases such as oxygen into the patient's lung by applying positive pressure. The theory behind this type of ventilator is applying high pressure in the machine that connects to the patient through a long tube. High pressure causes air to be pushed into the thoracic cavity that has a lower pressure through the tube, and the lung will be expanded. This process mimics the mechanism of inhalation, while for exhalation, the ventilator will stop applying high pressure, causing the thoracic cavity to have higher pressure and air will flow out from the lung through another tube. There are two types of positive pressure ventilator. First, invasive positive pressure ventilator is a ventilator that are connected with the patients through the tube, which is either inserted into a patient's airway or into the patient's windpipe. Generally, there are two types of insertion of tube in invasive positive pressure ventilator, which are endotrachea and tracheostomy. Invasive positive pressure ventilator is normally used in patients that are in severe condition and lose their ability to breathe. Thus, this type of ventilator is always being seen in intensive care unit. Next, non-invasive positive pressure ventilator. Non-invasive positive pressure ventilator is a ventilator without intubation but covers the patient's nose and mouth with a tight-fitting mask. And gas will be given to the patient through the mask and it is predominantly used in clinical treatment. There are three types of non-invasive positive pressure ventilator, which includes continuous positive airway pressure, which gives steady rate of air, bi-level positive airway pressure, which gives air of different pressure, and auto-adjusting positive airway pressure, which will adjust pressure of air giving automatically. Thank you. I'll pass to Yihan.
Thanks, Carlo. Now let us discuss the type of pressure ventilator that's suddenly used called a negative pressure ventilator (NPV). The main reason that it's less used include it is less convenient and portable to use, and it has a higher risk of causing upper airway blockages. NPVs were widely utilized in hospitals during the early 1950s polio outbreak. Additionally, many muscular abnormalities and issues such like COPD also have been treated with negative pressure ventilation. According to the principle of negative pressure ventilation, inspiration is started by an intermittent negative pressure that is produced outside of the thorax, which causes the lungs to expand and pull air in. Then you might be wondering, how does this negative pressure ventilator work? In general, an MPV makes the air pressure negative around a portion of your body. Your chest and lungs will expand because of the vacuum action, drawing air into your lungs. The device also releases the lower pressure, allowing your chest and lungs to contract and aiding exhalation. Here are some examples of negative pressure ventilator. After that, there are also a few important uses and applications in clinical settings to include. Negative pressure ventilation equipment can be a vital contributor to the pediatric critical care unit or neonatal unit. It helps in preventing the need of reintubation in a vulnerable youngster when utilized following extubation, allow pulmonary circulation to escape hemodynamic effects of positive and expiratory pressure. Besides, in the operation theater, it also gives a surgeon clearer working space, free of tubes or catheters, and prevent the issues of flammable materials when using lasers during an airway surgery or laser operations. Lastly, it also aids medium and long-term ventilation at home, especially for children with phrenic nerve palsy. Negative extrathoracic pressure ventilation is very useful in enabling them to come up positive pressure ventilatory support and leave the intensive care unit. Next, I would like to pass it on to Fujin. Thank you.
Let's take some time to look at the comparison table below. The points I would love to highlight are the mechanism, the presence of invasive or non-invasive method, and also the disease it is used to treat. Starting off with the mechanism, positive pressure ventilators pushes air into the lungs with a pressure higher than atmospheric pressure, whereas negative pressure ventilators sucks air into the lung with pressure lower than atmospheric pressure. Continuing on with the presence of invasive or non-invasive methods. Positive pressure ventilators includes both the methods, whereas negative pressure ventilators only includes the non-invasive method. In terms of the disease it was used to treat, positive pressure ventilators treats disease such as parenchymal lung disease, whereas negative pressure ventilators treats disease such as the recent COVID-19. I will now pass the time to Alicia, where she will talk about the improvements that can be made to the ventilators.
Lastly, the improvement of positive pressure ventilator. The development of additional non-invasive ventilator support systems, particularly positive pressure ventilations provided by the nose or face mask, has happened concurrently with the improvement in negative pressure breathing technique. NASA ventilations provide ventilatory support in the cases of chronic respiratory failure in older children or adults. When compared with the negative pressure ventilations, it has the advantage of convenience, comfort, and portabilities. In a study by Simons and Elliott, a NASA positive pressure ventilator was used for a prolonged period of time on 180 adults. This method resulted in an improvement of oxygenated and alveolar ventilations. And in a small subset of patients who switched from negative pressure to NASA ventilations, the blood gas tensions also improved. Face mask ventilations has been utilized by certain people as an alternative to NASA ventilations because NASA pressure are lost if the mouth are open widely. Children as young as 2 years old has used NASA or face mask ventilations, although it's very challenging to introduce a young children to the NASA mask or the face mask. In conclusion, positive pressure ventilation is widely used as a crucial part of the treatment of patients who needs a mechanical circulatory support. When used properly on a restricted group of patients, non-invasive PPV has a potential to lessen the needs of invasive mechanical PPV and increase the survival rate. For the advantage of ventilations is that it has a variations in the value of FiO2 from 24% to 100% and is highly effective for providing a higher pressure gradient, and the treatment can depend from patients to patients.